Hi everyone, this is Dr. Praveen here. In the last video, we have seen the parts of upper GI endoscopy. Today, we are going to discuss about the indications for upper GI endoscopy. The upper GI endoscopy is indicated for diagnostic procedure, surveillance procedure, screening procedure, and therapeutic procedures. So, what are the conditions where we can advise the upper GI endoscopy? First, we'll look into the diagnostic procedures. For the first one is dysphagia, difficulty in swallowing, like benign growth, malignant growth, or even sometimes the foreign body. So to diagnose such cases, so it needs upper GI endoscopy. Odynophagia, painful swallowing, and dyspepsia, when discomfortness in the upper GI and upper abdomen, where the other causes are ruled out. In such cases also, it needs to rule out the gastric causes and lower esophageal causes and duodenal causes. We need the upper GI endoscopy. Next comes vomiting, where we couldn't able to rule out or trace out the systemic causes. So in such conditions, so we need an endoscopy. Hematemesis, of course, hematemesis, it needs a vomiting blood, it needs upper GI endoscopy to rule out where the bleeding it is, whether it can be controlled by the endoscopy or by the glue therapy, means by the rubber band ligation or glue therapy, sclerosing agent, so whatever. So that needs upper GI endoscopy. Hematemesis and a typical chest pain. As we know, the esophagus also slightly on the left side, so the pain which is related to the esophagus also mimics like as that of the cardiac pain. So when the cardiac and pulmonary involvement are already ruled out, but in spite of that also the patient is complaining the chest pain, then we need to consider the upper GI endoscopy to rule out the possibility of involvement of the esophageal pathology. Next comes patients complaining of non-specific weight loss. So we couldn't able to rule out the other possible causes of the weight loss. Then also we need to consider the upper GI endoscope as well as the lower GI endoscope. And next comes people complaining of repeated chest problems, chest infections, or the cough. So conditions like achalasia cardia, severe form of the hiatus hernia, so where because of the GERD, gastroesophageal reflux disorder, the patient may get cough because of the irritation of the airway, and sometimes the repeated irritation may cause the infection in the chest also. So in those conditions also, if the cough, if you are suspecting the cause for the cough as the achalasia cardia or the hiatus hernia, then the upper GI endoscopy has to be considered. So these are the few indications considering the diagnostic procedures. As I told in initially, so even the upper GI endoscopies are used for the surveillance endoscopy procedures also. If the patient is already diagnosed as the Barrett's esophagus or else the esophageal varices, for in those conditions also we need a repeated endoscopy. In case of Barrett's esophagus, if the condition is low grade dysplasia, then on every 6 months we need the upper GI endoscopy. If it is a high grade dysplasia, then it needs every 3 months endoscopy monitoring of the disease. To monitor the disease, we need the endoscopy. And in case of esophageal varices, every 3 months he has to undergo the upper GI endoscopy till all the varices get banded. So like that is a surveillance endoscopy. Coming to the screening endoscopy, if the first degree relative has already suffered because of the CA esophagus, CA stomach, and even though the patient didn't have any complaint, then also the patient has to undergo the upper GI endoscopy on every 10 years. Next comes the therapeutic endoscopy. Therapeutic endoscopy nowadays, it's almost said that there is a saying, there is no scope to a surgeon without a scope. So even with the help of the upper GI endoscopy, we are doing the means many people are doing the appendicectomy. With the help of colonoscopy, they are doing the appendicectomy. So in a such a way, it's growing very fast and vast. So to remove the foreign body, for dilatation of the esophagus in case of esophageal stenosis, and to band the varices in the esophageal varices, to put the glue in the esophageal means in the fundal varices and all, and for submucosal resection, polypectomy, and many more. So they are using the upper GI endoscopy. Even to repair the hiatus hernia, they are using the upper GI endoscopy. So these are the few therapeutic uses of upper GI endoscopy. Coming into the conditions where endoscopy has to be done very cautiously, like in case of juncus diverticulum, where we find the blind end and the full stomach and non-cooperative patients. In case of corrosive poisoning also, if at all if you wanted to do the upper GI endoscopy, it has to be done within 24 hours. So these are the other conditions where the endoscopy has to be done very cautiously. Where the upper GI endoscopy is contraindicated. Conditions like suspected GI perforation and cardiac issue, MI patient, and the respiratory distress conditions. These are the conditions where the upper GI endoscopy is contraindicated. So if you have any doubt in the indication part of the upper GI endoscopy, you can write in the comment box. If possible, I'll try to answer it. Hope you have enjoyed the video. If it is so, then kindly press the like button and forward to the needed people. Thank you.